My name is Melvin. I am a forum moderator and associate publisher with the Hair Transplant Network. Today we're going to be discussing whether or not you can have a hair transplant with DUPA, Diffused Unpatterned Alopecia. But before we get started, if you guys are new to the channel, go ahead and subscribe. And if you guys like the content, go ahead and give me a like. And if you think anybody would benefit from this video, go ahead and share it with them. All right, now let's get started. So what is DUPA? DUPA is a form of genetic hair loss that is also caused by the hormone called DHT. Unfortunately, it doesn't follow any set pattern, so it can affect the donor area, it can affect the top, it can pretty much show up anywhere on the scalp. And this is why most patients aren't good candidates when they have DUPA. So how do you diagnose this condition? Let's get into that. Okay, so a lot of patients actually confuse DUPA for DPA, diffuse pattern alopecia. So just because you have diffused hair loss on the top doesn't mean you have DUPA, but it doesn't mean that you don't. You need to get checked out by a hair transplant surgeon that has the microscopic tools to evaluate the donor area. Typically, people have around 10% of their hair in the telogen phase, which means that the hair is growing thinner and it's going to go into the resting phase. Now, patients with more than 10% are at great risk of having DUPA, and sometimes at a glance you may not see significant thinning, but under microscopic evaluation you can see where the hairs start to thin. For example, you could have 3 follicular hair follicles where one is thick and the other 2 are starting to thin. This is a telltale sign that you will lose this hair in the future. So what are the treatments? Well, they're the same as male pattern baldness treatments. Propecia, finasteride, Rogaine, minoxidil, laser therapy, PRP, microneedling, derma roller. In extreme cases, some doctors even prescribe dutasteride, Avodart, which is not FDA approved to treat hair loss, but it is significantly more powerful than finasteride. However, you may want to get checked out by a surgeon or a physician to get your blood work done to make sure that that's even safe taking. I wouldn't personally advise it just because it's not FDA approved, but some patients do take it and they don't experience any side effects. So if it's something that you're willing to try and you're talking to a physician and they're looking over your health, then I would say go ahead and give it a try. All right. In closing, I'm going to add a link to an article that Dr. Glenn Charles wrote on this subject. Dr. Glenn Charles is a coalition approved surgeon. I'm also going to link our Hair Restoration Network forum in the description box. Guys, this forum has several surgeons answering questions and comments about hair transplant surgery, and also several senior members that have had several hair transplant procedures. Everybody there is friendly, but most importantly, if you're interested in having a hair transplant, there are hundreds of real patient reviews with no commercial hype, no BS. It's not cherry-picked by the clinic. If you guys are interested in having a hair transplant, that is the place to go. All right, till next time.